So what is Pelleve? As I said, Pelleve is radio frequency technology. So I will back up and explain what radio frequency is. And basically, it's an oscillating electrical current that generates heat. And it's in microwave technology, radio towers, MRIs. It's been used in medicine for decades now, and its original use was for cautery. And actually, the Pelleve device actually cauterizes in addition to its cosmetic applications, and it can also be used for tissue destruction. So you can treat warts and seborrheic keratoses and benign lesions that you want to get rid of through electrical destruction. And basically how it works, as I said, radio frequency generates heat, and this is targeted heating up of the deeper tissues to change the structure and the function of the skin. And so in doing that, that's how you address wrinkles and fine lines and skin elasticity. So it results in the improvement of the quality of the skin, what we think of as a younger looking face. As we age, many things happen. The texture of our skin changes. We can get uneven pigmentation if we've been exposed to a lot of sun. We lose collagen. We lose elastin. We even lose bone. Like part of our skin aging, as skin cosmetics has gotten a lot more sophisticated when we understand how the face ages, we actually resorb bone, just like we do in the hip. It's happening all over our skeleton, except we don't have pressure on our eye sockets. So, they're very targeted cosmetic applications. So Pelleve is specifically targeting the loss of collagen, the loss of elastin. So when you get a treatment, the skin, the wrinkles are reduced, and the skin is much more elastic and firmer. So those are the things that you're going to notice. It causes the collagen to contract. You have immediate changes in the proteins, the collagen and elastin in the skin, so you have an immediate effect, which is temporary. And then the more long-term effect, it happens a month later as your skin is generating more collagen and the elastin fibers are becoming more uniform. So one of the main features of Pelleve is that it's a painless and no downtime treatment, and that's how it works very well in my practice, and particularly in New York. I trained in California, and people have different tolerance for downtime depending on what part of the country you're in, and New Yorkers don't like downtime. Like, you can't do the same things that you do out in California and New York, and this just works very well for that busy person. So what are some of the benefits of Pelleve? Well, first, it's customizable. Everybody ages differently. Some people will just age around their eyes. Your eyelid skin is your thinnest skin, so it will show the signs of aging usually earlier than other parts. You can do a full face treatment. You could just treat someone's jawline, or you could, off-label. You go on the neck, the hands, or you could do a full face, and I think you get the benefit from the full face because one area affects another area. It's a very comfortable treatment. It heats up, but it's essentially painless. We don't need to use any anesthesia, numbing creams, nothing when we do the treatment. And I did it, and I found it very relaxing when I had my treatment. And it's an effective treatment. Obviously, why do it even if it's comfortable, if it doesn't do anything? In the experience, it's great for some people, but it's actually clinically efficacious, and there are studies that show that. And it's cost effective. In terms of the price of this technology, it's quite reasonable. And as you know, with cosmetics, it's what the market will bear. But when the technology is reasonable to the person who's providing the service, that gives them some flexibility in how to price something. So that makes that available to the patients. So, like I said, everybody ages differently, and there are different things that you would do to address certain signs of aging. So, obviously, Pelleve, you have to match the right procedure with the right patient. So, there's an ideal patient for Pelleve. Someone who needs a facelift, who needs surgery, this is not the right procedure for that person. But it's great for someone who wants something that's non-invasive, no needles, no injections. Someone who has, their issue is skin laxity. It tightens and it pulls. I think it was Paulina, the supermodel, the Polish supermodel, I don't know how to pronounce her last name, Czechoslovakian supermodel, who said beauty is a matter of millimeters. This is a great gateway treatment. As you notice, the little change in millimeters. So we tend to have even younger people coming in when they start to see something happening. And it gives you makes you look less tired. That's one of the things that tends to show more on someone's face. You know, as we get older, it's a little less forgiving. That's one of the things people really appreciate. And you can get up and go. You can go on a date. We have people who had it and they're coming in for the next treatment. They're planning it specifically the day they have a date, which is not usual with a treatment. But they had it before and they know the results and they liked how they looked immediately after, and they want to go out and get that, you know, enjoy the temporary benefit as well as the long-term one. So how does this work? The mechanism of action. So as I said, it generates heat. So basically this is a picture of the dermis, the skin, which is epidermis, dermis, and subcutis. And the dermis is that firm structural part of your skin where you have lots of elastin and collagen, and that starts to diminish as we age. And basically what the Pelleve does is it heats up that area and it causes kind of a little micro injury. You know, we hear about inflammation as being bad. Well, it causes a little micro inflammation. A little injury is good. It's like with muscles. You know, you work them out a little bit and then they get stronger. So this stimulates collagen production, elastin production, and changes the nature of the elastin fibers and causes a little contraction of the skin. So what is some of the data on Pelleve? You know, they've done many studies, a lot of them outside of the country, because you can do more things outside of the US. This is one study looking at how patients perceived the technology, a patient satisfaction study, and they had 49 men and women, ages 30 to 71, who had moderate to severe wrinkles according to the Fitzpatrick wrinkle scale, and it's basically a way of measuring, and there's a modified one as well. And they basically just had 2 treatments, 1 month apart, and they were assessed 120 days later after their second treatment. And so basically they found that there was a very high patient satisfaction in terms of laxity, smoothness, and brightness. You know, 80% and above except for brightness. I'm not actually sure how the brightness, that seems like a plus. But that's probably because their skin was smoother and probably reflected light better, so it probably looked more luminous. And then this is a study in which the evaluators were clinicians. They had plastic surgeons and dermatologists looking at pictures, and 93 patients were involved, and they only had 1 treatment. And they were assessed 6 months later, where they assessed at 30 days, 90 days, and 6 months later finally. And the evaluators found that the improvement from baseline seemed to be maintained. I mean, we recommend more treatments than that, but it's, you know, there's a lasting effect. There's something that's going on months later to improve your appearance. So patient selection, again, there is an ideal patient for the Pelleve, someone about 30 to 60 years old, who has mild to moderate skin laxity, you know, relatively elastic skin that will snap back, but they're noticing a change, not someone who has to push their face up. That's someone who needs surgery if they want to address that. Moderate jaw sagging, moderate laxity. It helps around the nasolabial folds, which we more conventionally use fillers for, but one of the advantages of this is, you know, with fillers and Botox, which are great, people do get concerned that they're not going to look like themselves, that they're going to look funny. That's not likely to happen with this. You know, it basically is just stimulating your body to do what it used to do, you know, rather than putting something else into your body. So it does help with the, you know, melolabial folds or nasolabial folds if someone has just modest, you know, folding in those areas. It's very good for perioral lines and around the eyes, for periocular lines, and it can help a bit between the eyebrows. That's what the glabellar fold is right here. That's traditionally a Botox area, but if someone just has light lines in that area, Pelleve can stimulate the collagen, because basically what's happening with Botox is we make expressions. We've been making them since we were babies. Babies get lines when they make expressions. It's just that their skin is more elastic, so it snaps back, and after time, it doesn't snap back. So Botox is relaxing the muscle, whereas this is stimulating collagen and elastin in the skin, so your skin snaps back. So it's a more natural effect. And early brow laxity, and that's basically, you know, a little bit of drooping, heavy upper eyelids. This can be a very good treatment to kind of tighten that up. A poor candidate would be someone who's primarily sun damaged, like their aging is that superficial textural change on the skin. This can help with that because it does, a lot of that is a reflection of a breakdown of elastin and collagen, but a lot of times that's a discoloration and different things, like freckling from the sun. So if this isn't addressing that, this may help. They may need to do something else. Someone with severe skin laxity, as I've said, they may need surgery. Very deep wrinkles, again, they may need surgery or fillers or Botox. And someone who has unrealistic expectations, which would be the case with any treatment, be it cosmetic or medical. This does what it does, and it does great things as long as it's aligned with what the person has. Okay, so what are the appropriate expectations? Well, one treatment, we've shown a study where they saw, an improvement after one treatment, but to get, the best results, we expect to do more than one treatment. We generally recommend 3 treatments a month apart. And I know a lot of the studies outside of the country, they were doing many, many treatments. But generally, you recommend 3 treatments a month apart, and then wait 6 months before you would consider doing more because it's continuing to work, it's continuing to stimulate collagen. There'll be some immediate changes. Those are more temporary. There may be a little bit of redness, but again, nothing severe. It's sort of like when you wash your face, you might get a little red, after you have your Pelleve treatment. There might be some mild swelling, but that's part of the effect, because part of what happens when you've lost your elasticity is you're drooping. That's how masks work and a lot of things like that are temporary. They're hydrating your skin, and so it looks plumper and smoother. So you get some of that immediate effect with the Pelleve as well. You'll notice a little pulling, like when you treat half a face. When we were testing out the device for our office, we treated half faces and we stood at the bottom of the table, and it was really funny to see, it really pulled up half the face. And then we treated the other side. And then over time is the main effect you're getting. You're getting the increased collagen production, increased elastin production, and that happens over months. So that's the idea, is that you get a long-term benefit. But again, not a substitute for plastic surgery. So here are some before and afters from doctors from various offices. And as you'll see in this picture, this patient has a full face. I don't know how many treatments this person done offhand, but as you see, it's not dramatic yet, it's different. You can see around her eyes, it's smoother. Around her nose, the melolabial fold. Again, it's not a drastic change, so it looks natural. It looks like her, but better. A little less tired, a little fresher. No one has to know. I just did yoga and drank water. This is, a periocular case, and again, this is after 4 treatments. And you see that's the thin eyelid skin, so that's going to respond, most to this. And this is an older patient, and we're looking at her eyelids and her crow's feet. And you can see that, again, it's not completely pulled up. It's not a blepharoplasty, but it's improved. She looks fresher, she looks younger, she just, looks brighter. And again, no surgery, no downtime. This is another patient, and I'm actually pretty impressed with the forehead results, because I actually would have not thought Pelleve would do that for somebody's forehead. I would have suggested Botox in addition, and I'm assuming that there was no Botox. So, in this patient, she got some benefit on her forehead and around the eyes, as we would expect. And you look at her mid-face, which is this part of her face, that's that kind of slow area where we age, and people don't necessarily know it, you know what I mean, but they just notice something's different and they don't know it's there, and that's where you tend to see a nice little a change with the Pelleve. And another case around the forehead and eyes, and again, this person's skin texture improved quite a bit. She had more fine lines, crepey skin, and you see it's improved. So my experience, my patients have been very happy with the Pelleve. I tend to have sort of a relatively, younger, like 25 to 45 patient population, and people want perfection in New York, and people are busy, so this works out very well for them. No downtime is very important here. Someone has to go back to work. You literally come in, get your treatment, go out. As I said, people use it before dates even. It can treat, another important thing is a device that's safe for patients of all ethnic backgrounds. It was originally FDA approved for the first 4 Fitzpatrick skin types. Now it's approved for all. And that's part of the nature of the technology. It's not affecting the melanocytes, the pigment cells. It's bypassing them and heating up deep layers of the skin. And it's been used, we've been using it off-label on everybody, for years, but now it's approved. And it's that instant gratification. People, even though that's a temporary thing and there is a long-term effect, people do like seeing that they got something before they leave, that there was something happened. It wasn't just like a hot stone massage on their face. And they are noticing a result in skin laxity, and improvement in their skin laxity, quality, firmness. Some of them can't describe what it is, and some of those are the people who might have initially said, oh, I haven't seen an effect yet. I said, well, you remember we said 3 treatments? Talk to me after you've had your 3rd treatment. And then towards the end, they're like coming in to get their 3rd treatment, and they're very happy because they're starting to see that longer term effect. And this is one of our favorite before and afters. This is a patient, and I actually thought that this is from my PA's phone. She took these pictures on her phone, and I thought this was after 3 treatments. This is like immediately after the 1st treatment. So she saw an improvement. You see it particularly around the eyes and in her mid-face. And now we will switch gears and start talking about the body, the Pelleve, which was how recently was it approved?
It was cleared from the FDA about 45 days ago, and we just launched it at the AAD meeting last week. And can I tell them? So Dr. Straughan's practice is the first practice in the United States to have Pelleve, but not only that, Dr. Strachan is the first patient to have ever been treated in the U.S. with Pelleve.
But no before and after story. I'm a person. So basically, Pelleve is taking this technology onto the body, and as you know, body contouring, the body treatment market is very big, and it's the same device. It just has a different handle, which is great. So if someone has a Pelleve, they're not having to buy some other big, equipment. It's a new handle, a new handpiece to use, and it's the same idea. No pain, no downtime. Your skin looks smoother. This device is cleared, specifically for heating the deep tissue, which is, the politically correct way of saying, skin tightening. That's how skin tightening happens, but that's not allowed to be said formally by the company. And it's for the temporary improvement of the appearance of cellulite. And cellulite is just very hard to treat. So, if you understand the sort of physiology of cellulite, there are a lot of fibrous bands. So really, it's going to be a temporary improvement, pretty much with anything until they come up with something completely different. And it's great for postpartum. Even on someone who's very thin and gets back into shape after she has a baby, the skin can be a little loose, so you can get satisfaction from that. It can be used on the arms, the buttocks, and the results are visible. So not only do you get the same skin improvement that you were getting on the face, you can get some of the fat. Some of the fat is reduced. Basically, with radiofrequency technology, adipocytes are destroyed. We recommend people to hydrate a lot, and that is cleared from the body. And again, you need multiple treatments to use the Pelleve on the body as you would the Pelleve in the face. So here are some before and afters. This is the fun demo. This is the pinch test. One side is treated and one isn't, and you see that immediately after you treat. This is someone who looks pretty thin, you know. I mean, you know, you'd be surprised she'd be in there getting a treatment, but you, even on her, you see a difference in terms of her very mini muffin top, if you could call it that, and that the texture of the skin is smoother. You know, tushies are a matter of taste. You know, you can see that the Pelleve in the post picture, it's smaller, the skin is smoother, there's less cellulite, though, you know, someone might prefer the before, depending on your taste. But if you want it to be smaller and tighter, then the Pelleve is what you would use to get that to happen. Here's another patient who, you know, postpartum, pretty thin, I mean, but you can see that she has that extra skin on the bottom, and, you know, after her third treatment, it's tighter. And this is an example of a before and after on the arm. And it's been used on hands as well. And again, it's subtle, but this bothers people. And I'm gonna point your eyes more towards like right around here. And again, I mean, this isn't that dramatic a before, but it's much improved still.
Can this be used in the armpits? Like, you know how people get that crepey look in their armpits as they age? And it, like, would that work?
I wouldn't see why it wouldn't. You know, I mean, it could be used all over the body. This is one of our before and afters. And this is immediately after, and you can see that kind of, you know, six-packy effect starting to come out, that definition immediately after the treatment. And then we did our own little pinch test. So patient's right is the side that's treated, and you can see it's a little tighter compared to the before. So Pelleve is bringing sexy back. So does anyone have any questions? Or